Hi, I'm Dr. Smith with Dr. Calvin's Clinic. Okay, so we're going to talk today about how to use kinesio tape on a shoulder injury. If you're not familiar with kinesio tape or KT tape, it's designed to treat soft tissue injuries to help stimulate healing. It's not designed as a stabilization, so it's primarily to help increase blood flow, lymphatic drainage, and speed up the healing process. So today we're going to talk more specifically about how to tape the AC joint, which is a very commonly injured joint in the shoulder, the acromioclavicular. So we're going to be working on taping an AC joint injury. It's a acromioclavicular joint. It's a very common injury in the shoulder. The joint is right here in this area. It'll affect the deltoid muscle and cause typically pain through normal range of motion in the shoulder. So what we'll do is we'll start with our 2-inch strip of KT tape. It's an 8-inch long strip, 2 inches wide. And the first thing I'll do is split it down the middle about 2/3 of the way down. Okay, so I've split this down the middle about 2/3 of the way. I like to just round the corners where it was split. It keeps it from peeling off as quickly. As we apply the tape, we're going to start at about the bottom of the deltoid muscle. So you can see where the deltoid muscle ends there. So we're going to start taping about halfway down the deltoid muscle here, and then we're going to have this split, one side go along the clavicle and the other side go up the trapezius muscle here. Okay. Alright, so when I prepare the kinesio tape or the KT tape, I've got my split here, and so I like to tear the paper on the back on each of these splits. It just makes it a little bit easier to work with. If you just slide your finger down, it'll start to peel off the back of the tape here. If you just slide your finger down, it'll start to peel off. You can kind of get a grip there. So the tape is pre-stretched. You don't need to stretch it extremely far. I'll have him bring his arm up just about halfway there, and we'll start this right here. We're going to come up, and then you want to anchor it pretty good through here, and then the bottom piece will fall off. So now with the split, we're going to have one split go along the clavicle and one split go up the trapezius muscle. So pull this off and just kind of pull this down again. You don't have to stretch it extremely far. You want to make sure as you apply this, the skin is clean. You can use alcohol swabs or something to clean the skin if you need to. And then same thing here. This one's going to go up the trapezius muscle. Kinesio tape will adhere over the next hour or so. Just by the body heat will activate so you can kind of rub it on there. After it's adhered, after about an hour or so, it's okay to shower with. It's okay to get wet. You want to leave the tape on until it falls off naturally, which typically is between 3 and 10 days. Thank you for watching. Continue to follow us on YouTube video. We'll do a lot more taping with different joints, and we look forward to it.